More than 1,300 Australians have been flown back to Darwin since the first repatriation flight touched down in October. Those returning passengers spend 14 days in quarantine at this workers' village in Howard Springs before they can return to their home states.
The 14 days is actually the benchmark, and yes, we're aware that that people can have either minimal symptoms or no symptoms.
Of the 1,331 passengers repatriated so far, 31 have tested positive to COVID-19. But what's raising particular concern is the time it's taking some people to return a positive test. The NT Health Department confirmed an 88-year-old man who arrived on a flight from New Delhi on November 28 had tested positive at the weekend. The positive result came on the final day of the man's 14-day quarantine period.
We've got family groups together, one member who's positive and they don't realise it, and then they give the virus to another family member.
What's more puzzling is a second case reported last week. Here, a 30-year-old woman who arrived from New Delhi on November 24 tested positive on December 8. Again, the positive test was recorded on her 14th day in quarantine, but the woman had travelled alone, so could not have contracted the virus from a family member. The Chief Health Officer rejected suggestions community transmission could be occurring within the Howard Springs facility.
This is actually getting an infection. It is not, as some have said, community transmission, which is where you've got cases in the community where you actually don't know how they got the virus.
More flights are due to arrive in Darwin this week as the federal government seeks to bring home as many stranded Australians as possible before Christmas. The Northern Territory government says the risk of community transmission from returning passengers has been mitigated, with every person required to submit a negative test in the 72 hours before they leave quarantine. Matt Cunningham, Sky News, Darwin.